everyone, and welcome to Spilling the Teeth. As always, I'm Mutton. I'm joined by a very prestigious guest. I'm still up north, would you believe it? Jayne Sproson, nice to have you on the show. For those who don't know you, and I know that a lot of people do know you, can you give us a bit of an overview of who you are?
Okay, so I've been in dentistry for over 30 years now. That's a long time. And I started my dentistry days with one of the big plan providers. So I learned an awful lot about dentistry then. And my husband's a dentist. And so I learned an awful lot more when I opened a practice with him. So we were business partners. And then also in the sale of it and helping other practice owners and also aesthetic clinic owners as well, because we were one of the first practices that had aesthetics in our clinic. So that's something that interests quite a lot of dentists, and that's been really helpful. And then we came back to the UK after we went off to Jersey in the Channel Islands, and there was a massive need for help for dentists to get out of this situation they're in now. And I was well placed to do it because they wanted somebody who had done it before, that it could trust, and that was independent to plan providers.
Yeah, amazing. So as I said, your consultancy is very, very well known. You've got your own, staged plan of what needs to be done. But before we get into that, like what sort of made you into that? You talked about how you were best placed and you felt like it was something you really wanted to do. What kind of was the
What was
drive?
the drive that? Well, we were doing consultancy, and we did a discovery day, we like a strategy day for somebody, and they were a mixed practice. And I looked at the numbers and thought, this isn't working. This isn't working at all. And the stress that it causes. And I just thought, no, there's more people that need help. So I went back to everything I had, all my content, everything I'd done, and just devised this method so that people had something safe to go to. And that's what they're looking for. They're frightened at that stage. And so it became, somebody said, oh, it's the Jayne Sproson method. And then off we went.
I forget, and that's sort of the infamous line that we see everywhere.
It
Yeah.
stuck.
Yeah, no, that's
Yeah.
brilliant. That's brilliant. And actually, I've been speaking to people about the shift from NHS to private. We've been speaking to Dr. Kunal Rai, who did a mixed model. Obviously, you talk a lot about going the full way. Um, w- what's the kind of mindset shift that a dentist will need to take on to sort of make that move, make that conversion?
Well, I think there's two separate areas. There's the actual conversion piece, and then there's the business transformation. So we would do both. So we would support you with the preparation and the actual conversion. But the mindset at that time is often, um, how do I just get out of this? Let me run away from it,
Yeah.
Just they're coming to me in desperation. Not everybody. Some people are smart and say, right, do you know what, let's get our ducks in a row. Let's be proactive about this. And increasingly, I'm seeing more people like that. However, mainly it's like, how do I get out of this, and how do I do it safely? Um, and that's really hard for them. And I have to help them undo all the things that they have thought about, like, I've got to get as many patients as possible because that's what it's like, isn't it? And
Yeah.
see as many patients and no white space and all of those things. And I'm going to lose my NHS contract. What will happen? So it's very fear based.
Mm.
And then the next part is where we are no longer shackled to the system that is running your business for you. And then we're into post conversion support, the business transformation piece, which when people come to me, they often think, oh, well, it'll be fine. I don't need that. But they're so heavily embroiled in operations and the stress with the NHS contract, they can't think beyond what's happening. And it's down to me to think for them
Yeah.
and put this plan together to make sure that once they're out, they are going to not just survive, but they're really going to thrive. And that's a big drive of me, to see them go from being so frightened of moving to, this is really exciting now. I can have the practice that I've always dreamed of, and they've got a nice blueprint to take forward.
Yeah, for sure. And with that fear, it's less them clinging on to the NHS
Yeah.
and more them feeling the NHS clinging on to them.
Yes.
Yeah, absolutely. Um, so when we're looking at that transition period, when dentists are, they're either going the whole hog and they're following by the book, or they're maybe taking a slower, more steady approach. With all that in mind, what are the biggest mistakes that you often see people make there?
It comes back to fear.
Yeah.
And it comes back to fear-based pricing, because one of the things that we do is really look very carefully at the options they've got. We don't just go, "Oh, come on a strategy and we'll make you convert." That's not what it's about. It's actually finding what is best for them. What is it they want and what's going to get the best result. But on a lot of the time, they're so frightened that patients won't stay, they don't actually do themselves any favors in terms of the pricing. And we've often gone into places where the conversion's been done and it's like, "Oh, it's supposed to be all right now," but it's not. And it's because the pricing hasn't been done correctly. And it's just this undervaluing themselves. I suppose if you think about it, the NHS has oppressed the real cost of dentistry. And when you're saying every day, £26 something, and the patient goes, "Oh, that's ridiculous," it kind of wears away at your self-belief,
Yeah.
you know?
Yeah.
It's this terrible lack of self-belief, and it's really important. But we will look at all the red flags, what could happen, what are the curveballs that can get thrown, and decide whether we think that person's actually ready.
Mhm.
Because I don't want a failure on my hands. Selfishly, I don't want that to happen.
Got a record to uphold.
I do. I
Yeah.
don't have anything else to sell, so I've got to make sure that whatever there was the last one is as good as the ones before. So
Yeah.
that's the imperative for them, and they like that. Yeah.
Yeah, for sure. I mean, I've seen before like a lot of people talking about like their clinical excellence, and with being on the NHS path means that it's silver fillings, it's plastic teeth, and
Yeah.
it's out the door.
Yeah.
Um, 5-minute appointments, very very quick turnaround, patients being seen in waiting rooms rather than in the dentist chair. Like a lot going on. Do you think that people sort of forget that life, and they go, "Oh, private dentistry, I'm spending more time with them, I'm wasting time," or
I find that very insightful that you've understood that, because I can remember, we would go in and listen to the consultation of the dentist that's newly private, and they had, you know, treatment that was ready to happen. The patient wanted it to happen, and they were still in the, "I don't know when I'm going to fit this in, so I'll put it off."
Mm.
And it's things like that, and it's a change and it's a habit, isn't it? So those habits have to be undone, and the longer that we've been in that habit, the tougher it is to do. So there's a whole program of leveling up, and that includes mindset too. And I think it's lovely that they're going to be able to go out and do the dentistry that they want to do and help patients in the way that they would like to. But they do miss things. I can remember seeing a picture. The lovely they had all the tech, and they had the camera, and the picture was up at the patient's mouth and went through the consultation. Completely missed all the wear on the teeth. Because the consultation they're previously doing, to get patients in and out in 5 minutes, get the medical history, do the cross-infection, get the consultation done, recommend. I mean, I'm speaking fast just to get through it. So yeah, it takes time, and it's important because we've got to get the prescribing right. Otherwise, the fees are going to drop,
yeah,
and the consultation's got to be right. So there's a lot of things to get right after conversion, a lot of things to consider.
part of the
And
journey is
to
reminding themselves to be a good dentist. Yeah.
Yeah, it is, and part of that is being able to have the time to listen to people.
Yeah.
So that's so important, and they do have that time, and they have to be helped sometimes in how to fill that time. So when you go in and say, "No, you've got 20 minutes for a regular patient, you've got 45 minutes for a new patient," it's like, "How am I going to fill that time up? What am I going to do?" And then later on, it's like, "I could do with an hour at least."
Yeah.
So it is. It's just a shift that some people are ready for, and some people need to be helped a little bit more.
Yeah, for sure. I think that one thing, we spoke about off camera is how dentists sort of do focus on that clinical excellence piece, but they forget about the business side of things. So I feel like we need to sort of explore that a bit
Okay.
more. So branding is one thing we talked about,
Yeah.
and that's probably what we see as like the base you should be good at before getting people in the door. How important is it that people need to stand out in dentistry at the moment, and how tough is it to bring people on that journey to make them realize that?
Well, if they've been in the NHS for a long time, then there's a bit of blinkering going on there, and it's hard to think about the future of dentistry and be visionary about it because you've had to follow this UDA path. But it is important. You have to differentiate yourself because all I see in the main is we do Invisalign, we do implants, we do composite bonding, we do this, and that's total commoditisation. And that, so what are you going to do? You're then going to, if I was the patient, I'd be then thinking, well, I don't really understand why they're different. So I'll just go for the cheapest one because it's dentistry, isn't it? And I'm expecting it, they should be okay. So we try and help them, well, we do help them with finding out what they really stand for because there's space for everybody, right? You
Yeah.
don't have to be the posh practice or this to be different, but you have to be known for something. And that's what we're trying to find out. What are you going to be known for? What can you niche down to? And go for that. Go for that space.
Yeah, absolutely. I think it's a great point. And also, like once they walk through the door, the patient's in the door, you've got your branding right, you've got your front of house right at the very least. The
Not
next,
always.
not
Sorry,
always.
not always. Not the amount of mystery shops I do. I do loads of mystery shops and I'm ringing up, are you taking NHS patients? And they don't give me any differentiators at all. They're information givers. We maybe should have an honesty box. And this is absolutely no criticism of the front of house at all. I've worked front of house and it's a hard, hard job. And I have total respect for these people because they can do it better than I can. But if they haven't got the resources, if they haven't got the skills, if they haven't got the systems, why should they be good?
So it's not just about their sort of visible brand online. It is
No.
about getting that front of house right and making it link together.
Well, that's what we do. Marketing agencies, as you know, you're the marketeer. They will get the brand guidelines, and that's it. There you go. Off you go. So you've got your brand guidelines, but we go beyond that, and we will talk about organisational branding. And I'll get the manager to help implement those behaviours that are required. It's not an overnight thing. When we have reviewed the brand, then we will do a whole day on patient journey. So we have the brand reveal, what we stand for, how did we get to this, what our archetypes are, what are our trends, what we don't want, who are our avatars, all of those things. Get the team to understand what branding is, and it's not just a logo or the colouring in department, as I like to call it. It's it is that their behaviours need to align with the external messages. Otherwise, trust is lost. And so that's where we need to support it. So we'll have a look at all the individual training needs of every person and help them. And help them get to where they need to be to level up. That's the key thing at the moment. It's a bit of a buzzword, leveling up, but that's what it is. Yeah.
Yeah, absolutely. And when we sort of talk about that branding journey, it also sort of leads nicely into the patient journey. Like, what's the patient feeling once they've got into your environment? Um, One of the things I like to do is try and get some small tidbits that people can walk away with. So, what's like a small change, or maybe a couple of small changes that somebody could make in that journey that would start to make them see a difference?
Well, as soon as you've got them into the book, I think it's a case of, I call it the umbilical sales cord. You never let them go. You make sure that they're welcomed. You're constantly following it through. But there was a chap called Paddy Lund. I don't know if you've ever come across him, but he inspired me when we opened our practice 20 odd years ago. And he had something called CNEs. I don't know if you've come across that. Critical non-essentials. Because patients can't understand that your crown margins are the best. Because dentists are obsessed that they've got to have the best dentistry and they won't put
Yeah.
things up on social media unless it's perfect and all the rest of it. But actually, it could be perfect to the patient in the
Yeah,
patient's
exactly.
eyes. So look at critical non-essentials. What can you do? There's a lip balm and there's umbrellas and there's all these things. There's cushions and there's blankets. And you think, oh yeah, I've heard all that before. But I'd like you to tell me, why is that not common practice then? If it's common sense, why is it not common practice? Why are we not looking at the CNEs and looking at how we can keep that umbilical cord to us so closely? So I'd say have a look at your CNE, have a look at your patient journey, and even ask some patients what would they like. I always think asking what they want. Sometimes they don't know what they want.
Yeah.
But it's always quite good to ask patients what they like, and it's rather than just doing the survey that CQC actually makes you do, make it meaningful and find out what your patients want.
Yeah, exactly. And with the either things like AO voice notes, like
Yeah.
you can have that conversation in practice,
And
take that qualitative data, and it still won't interfere with your clinical notes.
yeah,
So you can be constantly doing it, and you're having a conversation with the patient then.
yeah. No, I think there's so many things that you can do now and use, and you should be looking at all of them, seeing which is going to make that patient journey simpler, more elegant, but without losing the high touch. I call it high tech, high touch. I don't know if that's what you describe it as,
Yeah,
but
absolutely.
high tech. Yes, use all the tech, but don't lose the high touch, because ultimately, it's the people that will make the difference. I have worked with practices where they're not as pretty as some might as you might want them, but the team are phenomenal.
I mean, speaking about looking after the patients, I think that's a really nice like thing to be thinking about. And if you were going to think about what would be a key thing or key three things um, that you would need to do to make sure a patient feels looked after, what would you think those are?
From my experience, they need to be listened to. That's massive. Otherwise, they're just, if anybody thinks that there's more in this for you than there is for them, you've lost them. The trust is broken. They think you're a good salesperson, and that's it. So it's got to be listening. And the time to listen, and the place to be able to listen to them is important. Um, and I think always following through and communicating with them. And if a patient is only going to be coming to you twice a year or 4 times a year, then how can you keep in touch with that patient? What can you do to keep that connection? Because I look at it like this: with all the tricks in marketing now and digital marketing, all your competition are flirting with your patients. So think about it. And if they're feeling unloved, they might enjoy that flirting, and they might go and marry somebody else. So that's what I'd say, is treat them like you are. There's an old fashioned word, isn't there? Courting. My mother said, well, when we were courting,
Yeah.
that it's like court your patients. Make them feel like it's the first time they've ever been to you, and don't take them for granted.
Yeah, absolutely. Like a lot of dentists talk about, well, I don't want to seem like I'm selling to a
Yeah.
patient. And actually, I, I sort of say in return, if I'm talking with my marketing hat on, is that actually, if you have a conversation with your friend and you're trying to convince them to go down the right path, you don't try and sell it to them. You have a conversation and you listen. So I think it's really great advice.
Yeah, no, I think that it's the conversation. And if you do the right thing by the patient, it pays back tenfold, because we should be looking at lifetime value of a patient, not that quick buck to sell them a treatment plan.
Yeah,
Yeah.
absolutely. And not to give away any of your secrets with this sort of next question, but um, obviously we keep talking about marketing and sort of flirting with that idea of what's good in the marketing and branding world. Um, but there's so many channels nowadays. There's SMS, there's WhatsApp, which is slightly different. There's email, there's phone calls, there's the website in general. There's your forms, there's chatbots. Where do you think people should prioritize their time, like as a basis? Like what should they get right first before they start exploring all these weird and wonderful world of
I
marketing?
think they should be considering their brand and who they're speaking to, because you've got to speak to that person at the right time on the platform that they want. And so everybody gets excited about TikTok, but is that where your avatar is? That where your personas are living? And there's nothing wrong with experimenting. I always think it's a good idea to say, right, well, that's my main platform, that's my second one, but let's spend a little bit of budget on experimenting.
Yeah.
But you don't need to be a marketer. It's not rocket science to know that YouTube's a massive search engine.
Yeah, true.
And I think that might be somewhere where people are missing out. And another one that I think people are missing out on is LinkedIn.
Definitely.
I really think that, that's a space where it's not too noisy for dentists. And I'd be jumping right on that. And depending on where I was and who my avatar was, and so on. But there are some people who've realized that and are doing very well out of it. Yeah.
Yeah.
So, yeah.
Agreed. I work a lot with a guy called Ningandi Patel,
Yeah.
who runs ARQ training,
Yeah.
and he's huge on LinkedIn. That's one of his big tips. So that's
Absolutely.
really nice
Oh,
to
that's
hear.
good.
Yeah,
Speaking sense there.
yeah. No, that's absolutely great.
Yeah, but there's all the AIs, there's bots and everything, but unless you've got the systems in place to make sure it happens, then it doesn't. you're wasting your time. And I think you've got to ensure that you're not giving these things to people who don't have a clue about it. You've got to decide on what to outsource and what to keep in house. I think that's where I would be thinking about how I spend my money.
Yeah, and a lot of business owners, and especially in the dental world, sort of try and take a lot on their shoulders, and they would try to take a lot on. Do you have advice for those guys that really can't let it go and give it back to the team?
Well, I can get that.
Well, as so
I was guilty.
yeah.
I was guilty of that. And I had a very lovely day, I think, when I was about 43, many moons ago. And I realized that I didn't have to be good at everything because I suffered from head girl syndrome, you see.
Uh-huh.
So I was head girl, and it's like, oh, you're very good at this. Pat your head. Well done, you know. So I thought that's what I had to do and be good at it. And then I realized late in the day that I was a late developer that actually I don't need to be good at everything. I just need to surround myself with people who are good at it. I mean, there's obviously that trust and they've got to prove themselves. But I'd say, yeah, surround yourself with people and don't. What I do see, and again, absolutely no criticism to practice manager because they haven't been given the resources or the training. I see what a lot of what I call accidental practice managers.
Mhm.
And so, you know, look after your generals and then they'll be able to look after your soldiers, yeah? So I'd say really help that practice manager that you've got, or if they're really not suited to it, then stop it. It's painful for everybody.
Yeah.
Find them. They, you know, they often come from where they loved being patient facing, and they might want to go back. I did exactly the same with the manager. You know, she was telling me she'd like to be a patient care coordinator. I'm thinking she'd get bored, and I wasn't listening properly, and I should have let her do it.
Absolutely. And do you think that sort of getting that bit right, getting your, delegation right, but also realizing when you've got it a bit wrong, do you think that builds a really strong culture in the team and that's kind of a key to later on success?
So if we're looking at high performing practices, then autonomy is massive. They will respond, I think, far better than feeling micromanaged.
Mm.
But obviously, there's a capability issue. Then that's a different story, isn't it? Yeah, I think it is. And again, it comes back to the same things. Give the team clarity. Give the team consistency. Give them the team the resources they need. Give them what they need to be able to do it. Don't think they can do it without those. It's just being mean. so, so don't be mean to them, and it'll come back. It'll pay you back tenfold. Yeah.
Yeah. And I guess there's an element of, if we're going back to the talking about moving from NHS to private, do you have to remember the team on that journey, or do you think they just go
Oh
along with
no,
it?
it's absolutely massive. To get the team. Part of what we do is getting that team on board, and it isn't a quick 2 hours. This is what you need to do. Um, we we will do a full team training, and it's absolutely jam packed. But we have to get them to understand why we need to change. But I'm not going to go in and tell them why. I get them to tell me why. So that they and then create a vision for the practice they want. And then I just show them the first easy steps. So what I've got to do is make sure they have confidence, and we come back to the word clarity again, that when they go away, because they're petrified of what the patients are going to say to them.
Mm.
You know, that you're greedy, you're this, you're terrible, you're abandoning the NHS. So they're thinking of the worst patients they've got, and they are thinking, how do I face that? So by the end of the day, they should feel confident. Now, I don't think it's fair. Well, so you get a practice management system in and you train them, they think, oh, yeah, I know what I'm doing. And then it actually comes to it. You have no clue what you're
Yeah.
doing. So I create a manual for those who like reading and colored pencils and like getting those sort of notes down. And then I have videos that we put in a WhatsApp group so that they can listen and watch because learning is different for everybody. And then I'm in when the conversion happens at the beginning of the week. And so, yep, here I am, the conversion please, because I have very little time to get. I don't have the luxury of 6 months of onboarding somebody. I've got to get them doing what they need to do. But we do have a laugh about it, and I'm there to help them. I'm not there to hang them. Once they realise that I'm just there to make life easier for them, then they'll open up and let me do it. And I'm there. It depends how the conversion goes, but I could be sitting on stairs signing patients up. So I've done it before, or I could be just observing what the dentists are saying and so on. So I'm there, and then I peel myself away because I've got that nobody does it better issue going on, and I've got to lead them to it, and then, but we continue to monitor it. So having that team believe in the reason you're doing this, and it's not just, oh, we want more money. And they know, quite honestly, they know it. It's just giving that time to articulate it. And I've often had it where people have come to me for part conversion, and then the team are going, can we just not get on with it? Can we
Yeah.
just do it? There's a dentist who's frightened of giving the rest of the contract up. And it's just like, they're going, oh, can we just do it? Because it would be so much easier and so much better. And they sometimes see it before the dentist does.
Yeah, so
Yeah.
you quite often don't see very much resistance from teams, because I think that's what a lot of practice owners would be worried about. Oh, my team won't like it, and that's almost an excuse to cling on to.
We're always looking for excuses not to change, aren't we? And one of them is, oh, that's that contract. I'm giving it all back. And what if my associates aren't going to do it? And what if my team doesn't like it? And so it's any excuse. No, but if you look at the Kubler-Ross cycle of change, that's absolutely normal, because it goes something like, if I should know this, shouldn't I? Denial, anger, depression, bargaining, acceptance, and it doesn't necessarily linear, that change. It goes up and down, and it will be for the team as well. So I've got to help them get to acceptance and show them the first easy steps on how to do that.
Yeah, absolutely. Um, I've gone through a list of your FAQs that, and what a lot of people ask you all the time, and I think the one that sticks out to me that I'd just like to touch on, before we look to sort of wrap up is, can I just do a partial conversion and see how it goes? Obviously, I've seen a lot of people that have done partial conversions, and there's good and bad things about it.
Yeah, yeah.
What's your kind of answer to that, and what's your opinion on what's best there?
Well, until I'd seen the discovery day and all the data, I wouldn't say that, well, that's going to be the best, because I don't know. I don't have the data. And that would be like a dentist saying, I'll do a full mouth rehab without any x-rays. It's just not, you just don't do that sort of
Yeah.
thing. So I'll talk in general terms. Um, but there are people where, the numbers aren't stacking up so much and the risk is higher. So whilst I'll do it with them, if I think they're in the right place to do it, I would have to say, look, this is riskier, and this is what we would do as a contingency. Um, and that's for full conversion. If you're looking at part conversion, I would really only be recommending that where the numbers don't stack up, and there are maybe other challenges uh, to consider, simply because it's harder work.
Yeah.
It's so much harder work, and doing the conversion is tough anyway. But to put your team through it again and again, you're also giving mixed messages to the patients. And you've probably lost some patients because of the change in the way you've done it that might have stayed with you. It's just more complicated. There's not enough clarity, and it's harder work. So I say that if you can, and it all stacks up, it's a lot easier to do the full conversion. Then, and I can't lie. Maybe lots of people now not ring me up because I'll say that, but I've got to tell you the truth, and that is the truth. And as a marketing person yourself, you must see that having one clear message to cut through the noise is far, far better than, well, yes, you can be on NHS for this, and then you could do that. Oh, but we'll give you private for that. And it's just such a mixed message, and that's always harder to
Yeah.
get out to the community.
Yeah, I think the clarity is key. And I think that the thing you touched on about having to check the data is also key, because the kind of person asking that question is going to be so worried. And for you to say, actually, I'll check your data first,
Yeah.
that means a lot.
No, it's really, really important. And we will produce the modeling for them and say, look, this is because we will actually find out what they want. Because until we found out what they want and we explore all that, because they often don't have time to consider what their future is and how they would like to practice. So we do that in the morning of the discovery day. And in the afternoon, we'll look at all the financial modeling and what their current position is. And we will keep coming back. So as they go through the decision making, well, will that actually achieve what you want? Because what is the point of doing all that change and all that risk if you don't achieve what you want in the first place? And it's like I said about, we're running away from something. You need to know what you're running to.
Yeah.
And that's what we have to get really clear. What are we running to, so that we can create the plan and discover and actually discover what you really want and help you achieve it.
Yeah, absolutely. Okay, I'm done enough of revealing your secrets. I think that if anyone wants more, yeah, if anyone wants anything else, they do actually have to reach out to Jayne, I think. So I'll give you my last two questions and then give you some space to chat. So, um, trends. We talk a lot on this program about trends and coming up in the next 5 years, 10 years, how long it'll be. What do you see as as the big thing coming down the line? And it doesn't have to be AI or anything.
No, no,
It can be anything.
absolutely. I secretly wish I was back in practice, the truth be known, because I think this is such an exciting time for anybody who's an innovator. Um, from my point of view, from what I've learned about dentistry, I think it should be at the centre of health. And and this government or the other governments would have saved millions, billions of pounds if they'd actually bothered doing that, but they don't see it and they don't want to see it. And so if I was setting up again, I would be looking at longevity medicine and making dentistry the centre of that. And I have got clients that are on that journey now, where it's because their patients trust them so much. They're doing saliva tests, they're doing blood pressure, they've got counsellors, they've got physios. So it's looking at whole health dentistry, whole body dentistry, and there are people on that journey right now. Don't you hate that word, but you know what I mean.
I know.
And I think that would be amazing, and that's what I would want to do. And then I think the other thing to look at from a business point of view is private emergency service, because I mean it's there now, but I think it's only going to get bigger and bigger because I don't see optimism over experience when these practice saying, "Well, I'll hang on to my NHS contract. It might get better with the uplift, or if they do this, or if they do that." You just need to look historically. It's not going to happen. Accept it and work out what you're going to do from there. And I'm not saying, oh, having a posh practice or doing longevity is the right thing. I'm just saying that interests me,
Mhm.
and it's a trend that interests me. But it could be that you think, do you know what? I just love to get people out of pain and deal with those people where dentistry isn't important to them.
Mhm.
It's not their priority. They just want things to work and they don't want to be in pain.
Yeah.
And there's a market for everybody. So that's what I think the trends would be.
That's super interesting and stuff that we've not heard. And I think a lot of people will be interested to hear that. We could have done a whole other episode about longevity, I
Oh,
think.
honestly,
But
I'm fascinated with it. I'm just very passionate about it. Like 20 odd years ago, I saw facial aesthetics coming in and body therapies, and we did it. And we're one of the first practices to do it. And now I just think, oh, I'd love to be back in practice. I'd
yeah,
love to do this.
lots of exciting.
Yeah, lots of it. If you don't be despondent, if you're in a terrible place right now, there are some amazing opportunities for dentists. Absolutely amazing. It's a very exciting time for dentistry. It's just getting out of that mire that's holding you back.
Yeah. So, a dentist who's looking to elevate their practice up in 2025, they've got to take step one. What would be your one piece of advice? What would be that step one for you, other than reaching out?
I think they've got to be strategic. Because I know I've worked in dentistry and I know how operations can take over. And it was a big lesson when I had to go back into operations, and how much it stops you looking at a vision and some sort of strategy. And I say, find somebody, find somebody that you trust, that's got experience, that's got a good track record, and you can't do it on your own. Look, when I did my branding, I didn't do it on my own just because I can do it. I got somebody else to facilitate it, because you can't do that on your own. You need somebody to be there, and then you need to put it into action, because talking doesn't cook rice, as they say. you know?
Yeah.
So, so that's what I'm saying: strategy, and then execute the plan.
Amazing. Great advice. Great advice. Well, thank you for your time today. It's been really, really cool to talk to you. Loads of great ideas, all new stuff as well, which is always very exciting. Um, Here's where I give you the floor to talk about anything you want to talk about. If you've got something you want to announce, if you've got something, a plea you want for the industry, anything at all, let us know. And this is your space.
I think my plea would be to stop seeing NHS and private. You're all dentists. You just happen to be working in a different system. So work together. That's what I would say. There's plenty of business for everybody, plenty of business. And I would say that if anybody just is thinking about it, do reach out. There is absolutely no pressure to convert fully or partially, but I just think it's a really good idea to know what your options are and what the implications are. And you don't need to take it any further than that. So those are my two things I'd like to say, and thank you for the opportunity.
No, no worries at all. Thank you very much for speaking to me. So, guys, thank you for watching. It's been a really insightful episode. I've been super engaged the whole way through, which is really exciting. I will leave it to my final question of the episode for you to take away and give us your thoughts in the comments. Um, what do you see as being the most exciting thing to be coming in the next 5 years? Do you think it's something clinical like longevity medicine, or do you think it's something more technological? Thank you very much, and we'll see you in the next episode.